you very much, Adam. It's a very kind welcome. Thank you very much. So I think as Adam's mentioned, my name is Neil Pearson. I head up Health and Safety at the Health and Safety Executive. I'm delighted to be here today talking to IOSH Essex Branch members, but also wider members of IOSH. And yeah, just really to impart some of my experiences at aiming to implement an excellent culture within the regulator, HSE. I've been in health and safety for about 23 years, as a practitioner, like many of you on the call, first 10 in private sector, second 10 in public sector. And I think as Adam's alluded to there, it's some probably of the more diverse risk profiles in the UK, particularly supporting our scientists who work in the marine environment, having to go on board trawler vessels, but also, within defence, trying to ensure that we are able to counter any threats and protect our brave troops who fight on our behalf. So really interesting dynamics. And then it took me to HSE, and really interesting and unique role where I'm the practitioner within the regulator, and obviously working with colleagues like Adam and others to really ensure that we do what we expect others to do to an excellent manner. So today's talk is about what we've done, and hopefully I can share some thoughts and ideas of how we work on culture change. So in relation to, I'm just going to share my screen. Hopefully this will work. Can you all see my screen okay? Yep, I've got a thumb up. Fantastic. Okay, so the title is unlocking the potential of HS policy statements of intent in HSE's approach to culture change and improvement. So I think just before we start going into the talk, I've always found, being in health and safety for many years, I've always gone back to my early days and thinking about, what did I used to do with policy statements of intent? I remember that, for many of my early points in my career, it was generally a page which was laminated and stuck up on a notice board in some of the organizations I was at. Didn't really change much through the years. There was lots of compliance statements in there. Generally, the boss tended to sign it at the bottom, and people didn't tend to pay a lot of notice to it. And that really interested me in the first few years, particularly as I started to look at, well, where does this come from? Why do we do this if not many people are using it? And what should we be doing with it? And I think, coming into HSE, that really sparked some interesting questions as we looked at our own approach. So I suppose just some background for many of you will be familiar with this. The origins of the statement of intent come from a tragic event in many ways, and that was a sad loss of life and many children at Aberfan in Wales, in South Wales, and it led to the Robins report, which was in 1972. This was a real change in health and safety. It led to the Health and Safety at Work Act, and ultimately the foundation of our organisation, HSE. We're coming up to 50 years as an organisation. And one of the key things really in the Robins report was a focus on the fact that the country needed to move away from telling organisations via prescriptive manners, what to do to ensure, risk is managed, and wanted to build, a different framework, something where organisations who created the risks, controlled them, they had the responsibility of managing their risks and being able to demonstrate how they're managing them effectively. And I think, one of the key statements also coming out of the Robins report, and I think this is really interesting, it links to the policy statements of intent, probably led to lots of the elements of Regulation 2.3 at the bottom, is that what the aim was to create conditions for more effective ownership, not just by employers, but by work people jointly. And I think that was a really interesting statement. And I think many of you on this call would have read our Act often, I'm sure. And it's one statement which we probably just take for granted. But if we look at Regulation 2.3 of HSE, it actually says in there that we should prepare as often as may appropriate, revise the statements of a general policy, respect health and safety at work of employees and organisation, and arrangements for the time in carrying out that policy, and to bring the statement and any revision of it to the notice of all employees. So that was generally the start of this approach in 1974, where people started to build a statement of what they wanted to do and think about how they brought in co-workers jointly. We've done a fair bit of guidance on that since, and one of probably still for me one of the best pieces of work coming out from HSE, and really which really helped organisations. It helped myself when I wasn't at HSE, was HSG 65. It's now called Managing for Health and Safety, and many of you remember Successful Health and Safety Management. The model we use is Plan, Do, Check, Act. For people who are more old school, you'll remember POPIMA, of course, but actually the intent of both models are very similar. And when you look at the way we look to help organisations in understanding how to manage health and safety, policy is still at the very start. So you can see on the model on the page there, the very start of planning, when we're going for this cycle of improvements, policy is right there as number one. And just some key extracts from what we say in HSG 65. They're really interesting. So the first one is to think about where you are now and where you need to be. And lots of organizations may have vision statements or mission statements and things. Actually, if you look at our guidance for the policy, we're asking you to think about that in relation to health and safety. We then have, can your policy reflect the organization's values and beliefs? That's a really interesting one. It's quite a close and personal one for an organization, is it? Can your health and safety general policy statements of intent reflect your organization's values and beliefs? And then the final one, which again is linking, to behavioural safety in many ways, is make sure your actions and those of your workers mirror the statements that you have made. So some quite powerful statements in HSG 65, which aim to provide a consideration of what we should be thinking about when we're setting up that PDCA cycle, and in particular, thinking about our main health and safety policy statements. So when we looked at this in HSE, just going back to 2018, 2019, so it's way before the pandemic, before Brexit, other things happening at that time. We really wanted to look back at our own guidance, our legislation, and we wanted to really reflect on how we could, hold ourselves to account in relation to the guidance which we want to give to other people. So we did this through our main committee, so I'm sure many of you on the call have health, safety and wellbeing committees. Ours is an integrated approach, so we're health, safety and wellbeing. You'll see me talk often and say HSW. Many organisations I know have health, safety, fire, security. There's different connotations of different risk topics, etc. We have health, safety and wellbeing. And in our rebuild, particularly, we wanted to refresh our own method of improvement and culture change. We considered a few things when it come up to that very first P, policy and PDCA. So the first thing we asked ourselves is, who is the policy aimed at? And this brought some really interesting questions. For many of you out there out in a wider world, it'd be really interesting to get your thoughts, perhaps at the end of this talk about that. And hopefully many people would say, well, it's aimed at our people, our employees. Some people would say it might be aimed at an insurance company. Some people might say it might be aimed as an assurance statement to people like us, a regulator, or another form of accreditation. Perhaps it's a ISO 45001 accredited body. So it's really interesting to say, well, actually, who is the policy aimed at? And then the next stage then is, well, who should be actually involved in building it? So is it something we simply just say to the boss, what do you think? We need to reflect your intent in the organization. Can you tell us what you want to do in the space? We'll write it down and get you to sign it and put it on the wall. Or do we need to involve other people? And that was certainly an area we looked at. And the way we did it was we constructed some basic statements and then got lots of working groups to focus in. In particular, we involved our trade union safety reps in that. So our CEO at the time absolutely was involved, but more than that, we asked a number of work parties to think about what statements we should include in that policy. And then, as we're going to allude to in this talk, what role does it play? Is it simply a statement of assurance? Is it an enabling document to really build the rest of the management system from, et cetera, et cetera? And we we thought the best way to do this would be attempt to use it as the driving document, the enabler to start a different approach to culture change. I think the final discussion we had was around the rest of the cycle, really. As you all know, PDCA, Plan, Do, Check, Act. Well, if we're starting the P in policy in this new approach, what are we going to do to measure and monitor it? And perhaps I'll talk a bit more in the next few slides about our approach to that as well. So many of you might ask what our statements are of intent, and the results of that work. It took about 8 months, and it was a long piece of work. It was a highly consultative piece of work, but we arrived at a number of key statements, and you can see them on the screen there. As many of you know, we have a quite a powerful mission statement, actually. Just a plug, we have just published our new 10-year strategy. I'm sure many of you may be aware of that in the news. And our new strategy, Protecting People and Places, is out now to have a look at. And certainly, it links, this is our previous mission statement. And we say our mission is to prevent death, injury, ill health to those at work, those affected by work activities. Our first statement of intent to our colleagues in HSE was, we take our responsibilities to you just as seriously. And that was an important aspect right at the start. What we then discussed was, well, how are we going to achieve that? How are we going to take them responsibilities just as seriously? And we wanted to be very clear. And many of you have seen, no doubt, from all of the publications we've had and the communications we've had in the past few years, that we do believe that health and safety should be led through people first and foremost, and then supported by clear, proportionate management systems. And you can see, actually, that's our second statement of intent. The third statement looks very simple, doesn't it? 5 words: we will manage our risks. But actually, for many of you who are risk practitioners in the audience today, you will probably put quite a lot into that. So when we say we will manage our risks, we understand that to be the way we effectively identify our risks, the way we understand how we're applying a hierarchy of control, and then what we're going to do to monitor the effectiveness of our controls and then review them. So we will manage our risks based on the diverse risk profile we have. It's quite a powerful statement of intent. So they were sort of the real key 3 statements we implemented as an organization. We then wanted to bring people's attention more visually to what that means for everyone in the organization. What do we want to enable people to do at HSE? And we broke it down into a philosophy we call Me, Team, Task. And this breaks down to 3 areas of our statements of intent. So the first one you can see on the screen there is, we want to enable everyone to be alert to risk. Now, for many people who are used to things like high reliable organizations, some of the theories on HROs, being alert to risk is really important. And if you can imagine colleagues like Adam, who sat in the committee there, we want our colleagues, when we're out in duty holders' premises, to absolutely be alert of the risks around them, but also within them. So this is where it links into mental health and well-being as well. So understanding and recognizing really quickly when things change, when things emerge around us. And we do a lot of work in that area. And then the second one, of course, is, when, right across the civil service, people are absolutely committed to performing, a high level of public service. And our colleagues in our organization, all nearly 3,000 of them, are absolutely motivated to look after people in UKGB. And the one thing we want to do is ensure that if people in our organization recognize that things are changing, risk is changing, they're reacting, and perhaps at points stopping to prioritize their own health, safety, and well-being first. So that was the first part of what we call our Me, and being alert to risk. Second one then is clearly after yourself. If you're looking after yourself, you're alert to your risks, you're reacting when needed, is caring for others. So as a team, looking after your team, making sure you're taking time to listen, support colleagues there, but also making that work balance with health and well-being, and ensuring that we have that right balance within our organisation as well. Final part of our statements of intent then move into the task side of things. Our tasks are very variable. Many of you will have various experiences of HSE. I think as Adam mentioned at the start, we have about 1,300 operational colleagues who go out to visit duty holders' premises, carry out inspections, investigations, etc. We also have lots of people working in our offices. And then we have a science technology laboratory facility up in Buxton, where we have scientists who do quite novel things. And generally, that's understanding how things have gone wrong in the UK. So potentially use of explosives, various forms of hazardous substances, testing PPE. I'm sure you'd imagine of all the different science we do. So when we're doing all them tasks, what do we want people to do? We want people to stay healthy and safe. We want people to play the part in our arrangements. And as an organization, we want to learn. You know, absolutely, like every organization, although we're the HSE, many of you would expect us to be practically perfect in every way, a bit like Mary Poppins. Clearly, we have to ensure that we are learning from things. So it's encouraging understanding when things may have gone wrong, pick them up and learn lessons from them, like every other organisation who's a duty holder out there. So that forms our key statements of intent. And if you go to any of our offices, you will see this poster up there. This is our current health and safety and wellbeing general policy statement of intent. You can see the text I've taken you through there, and at the bottom it's signed and supported by both Sarah Alban, our CE, and Sarah Newton, our chair. And both Sarahs are really involved in this. So certainly, you know, when we have reviews, particularly in our committees, which Sarah chairs, you know, we're constantly reviewing this element of our system. So that's our health, safety, and wellbeing general policy statement of intent. And I suppose, you know, lots of it then is, well, how do you link this into culture change? And to do that, we wanted to use one of our own models. So many of you again out there would use models like the Bradley curve. You know, there's lots of different culture change models out there. So DuPont have one. There's a number of organizations and consultancies who've developed culture maturity models. Well, at HSE, we have our own. Again, I may plug some of our offerings from our science and commercial team, but what we decided to do was use our own internal model to understand, if we've set this up as our statements of intent, how are we going to understand if we're meeting them, and what we're going to do about actions in relation to making sure we can fulfill them. So this is the ACE model. Hopefully you can all see that reasonably clearly on the screen. It's set on a number of stages. We call it the ACE wheel. So it stands for Achieving Culture Excellence in Health and Safety. So we call it the ACE wheel. First step is foundation. So as many of you, I'm sure, will be aware, it's getting that commitment. So our policy statements of intent were a key part of that top level commitment, signing up to that, understanding what conditions we wanted to create, and then creating a project, and then creating a communication. So as you can imagine, right at the start, back in 2019, there was a big focus on how we communicated lots of this information. Then we move into analyze. So this is a stage where you gain that valuable information from colleagues in the organization. So what's the current state of performance in risk? So understanding data analysis, you know, incident information, health absence information, you know, perhaps for additional audit reports, etc., perhaps do some benchmarks of others in a similar industry, so we can use other elements for civil service, particularly looking for trends, and then perhaps moving into doing some staff surveys as well. And I'll explain what we've done in that space as well. When you've gathered all that information, you start to analyze it and you get results. It's important that we focus in on them results, and the focus stage in red there, you can see on that part of the cog. That's all about working with colleagues, representative numbers of colleagues across an organization, say, well, these are the outcomes, these are the kinds of things we found when we've looked at our culture. What do you make of them? And understanding perhaps some of the lower scoring points, some of the higher scoring points, and what's that mean. So that's where the focus stage comes in. Once you've focused, understand some of perhaps the issues, problems, the good parts, sharing a best practice, then move into ACT. And in the ACT, very similar to the PDCA model, basically, you're looking at what interventions you can put in place, what ways you could enable the organization to get to where you want to be. And then the final part, of course, is potentially before you start it all again, is just understanding what impact it's had. And it comes into measurement there. So the ACE wheel itself, which is available from Science Division, and I think lots of organisations in the UK, but also around the world, use our human factors specialist teams in Science Division, in what was usually called HSL, to help them on that culture change journey. We use that expertise internally to help us go through that process. Got one more model for you. I know every good health and safety practitioner likes a model, don't they? But I think this one really helped us, and something in the organisation which, when we were communicating what we were doing, this was really helpful. It's called a force field analysis model, and it really just talks about, how do you get to where you want to be. I think, we talked at the start about unlocking them policy statements of intent through culture change, and certainly, in terms of driving forces on the left, to get you there, you need a force behind it, don't you? So many colleagues in this virtual network would have had various ways to secure a drive to do things better. Sometimes it can come from incidents, and one of the great strengths of our organisation is HSE is we do hold organisations to account, don't we, for poor performance in this, and so it might come from intervention, it might come from incidents. On a proactive space, it might come from a top level commitment, so a drive to be excellent at health and safety, so a drive from the top. Our drive obviously come from our policy commitments, as we've mentioned, and we also commissioned what we'd call the ACE at HSW change program. So we've got a program which is a series of projects which aims to understand how we can improve how we lead through our people, and then underpin that leadership with better systems of work. So there are driving forces. You then try to get to your desired state. You'll see our desired state, very similar to our statements of intent. So we want people to be alert to their risks. We want people to care for each other. We want people to stay healthy and safe. That's our key drive in our statements. The other side then, of course, is resisting forces. And this is what pushes back on your driving forces. And I think in many organizations, this can get quite difficult at times, because to find resisting forces is not always as positive as focusing on the driving forces, is it? But it's a really important part in that culture change model. And I think if you look at most culture change models, this is the part which often forms the greatest challenge for an organization. So that's when you're gathering that intelligence. So what's it like on the ground? What's it like in the real world? Looking at management arrangements, looking at results from people surveys. We constructed an ACE survey, and our ACE survey actually was a mixture of questions from the stress indicator tool and the safety climate tool. So our experts put a piece together and then plugged that into the results we already had from our people survey. So we had a well-rounded base of questions on health, safety and well-being, climate and culture. And that was a really powerful element to this piece of work. Then the focus groups, well, if these are results, what do you think, people? Interviews as well, so more structured interviews on certain subjects, and then, as we said, instant health information. So in many areas, and I'm sure many of you on this call, you would have experienced a situation where you have a really good driving force. You really know where you want to get to, a desired state, and you can see on the far right there, you'd have desired goals. Ours is simply to reduce our risks and improve health and well-being. I mean, there's some very basic goals, but they're fundamentally important, aren't they? The resisting forces are sometimes the hardest things to manage, aren't they? And how you then understand them, and then understand what actions you have to put in place in that force field model to work on them resisting forces, to enable you to achieve that desired state and that desired goal. So they were some of the ways HSE has tackled culture change. Clearly, it's not an overnight job. Like every organization, we do recognize that any improvements in performance, in culture, can take a number of years. And this program is still planned to go on for a number of years yet. So absolutely, after doing all the focus work and the ACT stage, we're really working hard on actions to ensure that we try to get to that desired state at all times and achieve our desired goals. In relation to COVID, I think for many of you, it'll be very similar in different organizations. There was a real benefit to the timing of when we did all this work. So this was back in 18-19, and as we all know, the pandemic really hit hard in April 20. So what the statements of intent enabled us to do was provide a framework for our colleagues through COVID. So that me, team, task philosophy, if you think of them words again, being alert to risk, caring for others, and then staying healthy and safe when we do our tasks. that formed a really crucial framework when we had to approach our duties in COVID. As many of you are aware, like other civil servants, we had a public duty to understand if workplaces were implementing suitable controls for COVID, and it meant that our people going out into that environment through various periods of restrictions and lockdowns. So we really had to work hard on that me team task philosophy. So that really helped us, and it underpinned many of the areas of culture change we're still working on now. So that was really important. So I think in relation to the questions, I hope you all found that presentation useful. There's plenty of detail behind there, but what I'd like to do perhaps at the start, and I've got Adam ready and standing by, is we have a number of poll questions. So perhaps if we worked on them poll questions, I'd like to ask you two things in the audience first. So the first one surrounds how you use your health and safety policy statement of intent. So poll question number one, I believe, Adam, does that come up? Oh, there we go. Perfect. Thank you, Adam.
Just
and Brenton.
For you. So.
Yeah. So is your organisation's general health and safety policy statement used in culture change improvements? So just be interested to see, just as a...
So people are just starting to answer now, Neil. We'll give it a minute and then we'll end that one. You can see the results. Okay, right. I'll end that and I'll share the results now.
Okay.
So you should hopefully be able to see that on your screen.
Yeah, that's really, really positive, and it sounds great. And I suppose it shows how far we're coming as a country in terms of some of the work we're doing around culture change and enabling change. So great, 72% of you are using your health and safety statements of intent in that fashion to drive some culture change. So that's fantastic. And a really interesting response. I'll be interested to perhaps get some of your thoughts in a chat bar on that later. So if we could possibly move to the second question, Adam.
That should be up now for everyone.
Yeah, so this comes in around some of the work we just talked about in measuring and monitoring. So how many of you measure and monitor how your organisation is fulfilling them statements of intent?
Okay, I'll close that in about 5 seconds. And there's the results for you now.
Okay, thank you, Adam. Well, and again, a really good result. So 64% of the poll have indicated that them statements are measured. It can be quite hard, can't it, to measure somebody's statements. It's probably a bit more challenging understanding how you can change a statement into a measurement tool, whether subjective or subjective. Clearly, staff surveys do well for that, or pulse surveys. But again, a good healthy chunk, slightly lower than the use of the statements of intent in culture change, but a good healthy score there in relation to measurement and monitoring. So I think the final piece, just before we move into wider questions, was around the third poll question. This is linking to support, and it's something Adam and I have talked about quite often, is the real advantages we have in HSE and other parts of the civil service in using what we call an employee assistance program. So we just wanted to know perhaps how many of you out there have the services of an employee assistance program right now. Okay, that's really interesting. I suppose it's just coming to an end now, is it, Adam?
Sorry, there's your results there, Neil.
Yeah. Okay, so 34 of you out of 40 have said 85%. So that's excellent, and it certainly it really helps, particularly on the piece around recognizing risk, reacting to it, and sometimes reaching out. We talked about care for others in our statement of intent, but having that wider group of people, particularly experts, to talk to when perhaps your colleagues are not able to help in certain ways, that's a really big advantage. So that's a really good result as well. So with that, people, more than happy to take any questions on what we've just talked about. Happy to provide any information. So Adam, are you taking the questions?
Thanks, Neil. So we've had one or two messaged in, and we've got a few in the committee, I'm sure. You mentioned you've got your plan, do, check, act journey. Where are HSE on that plan, do, check, act journey now?
Yes, so that's a very good question, and of course, you know, you go through this at various cycles in different parts of the Culture Act. So we've done a lot of planning. So we did our foundation in the wheel, probably as I say about 2019, went into analysis and focus through the pandemic actually. So we wanted to understand. Remember, we talked about an enforced field model, then resisting forces, which potentially can not, you know, get us to that that desired state. So we did that in 2020. We're building and we've built action plans now to take that culture change forward. So we're constantly, like many of you, you know, revising our management arrangements. So, you know, one of our statements of intent there was, you know, having clear, proportionate systems. We do that often through our committees, but actually the real action in relation to culture change, we've built some culture change plans and we're communicating them. So we're probably, in relation to the doing, we're at the doing. The checking will come after we've implemented lots of these actions as we go through that cycle again, and we start to understand the impacts of that change.
That's great, Neil. Thank you. I've got a question from Elaine here. It says, have you noticed an increase or decrease in stress post-COVID?
It's a really good question, Lane. I think you know, right across the UK. I mean, one part of my role, which is a really advantageous part of my role, is that I'm surrounded by world leaders in various topics in health, safety, and wellbeing. And we have our chief psychologist, Peter Kelly. We have a whole team and policy team on managing stress, and our human factors teams who design the stress management standards, our management standards. And you know, we've got steering groups within our organisation who talk about this all the time. I think, like all organisations, probably around the world, we've seen an overall increase over the past few years. You only have to look at our published incidence statistics to see the number of millions of days lost, not just in the UK, around the world, in relation to stress. So there has been a natural increase, like in many areas. I think one of the challenges which we always face, like every other duty holder organisation out there, is what's in your control and out of your control. You know, we've got situations in society, you know, it's become more challenging, the pandemic, Brexit, world affairs, we've all seen them on the telly, you know, that change, and also lifestyle changes. You know, we've evolved as a society. You can imagine just in the past 50 years, you know, thinking about information technology, the always on culture, various demands at work, you know, even people who've been, you know, born and gone through school and now into work with a completely different set of you know, views in relation to information technology, etc. So I think there's a change in society. What you really have to focus on is what work can do to manage the impacts of stress. And I think you all know my view would be around the management standards, and what we do as an organisation constantly is look at them 6 factors to understand how we're performing in that. And certainly the culture work we've just talked about, when we use the questions from the stress indicator tool and when we use the questions in our people survey, we were able to form a really good point about how the 6 factors affect stress within HSE.
Thanks, Neil. We've got a comment on that. It's from Max Fox, who says, we are a